Hey, what's up everybody? It's Aaron here with Iron Therapy Training, and today I have Sandra here with me with Sandra Burton Massage, and she's over at Renew Salon and Spa right here in Great Bend. And we have a special talk we're going to do today, right?
Yes, we do.
And it's all about the butts. So we're going to talk about the trends that are going on right now and the vanity and problems that are behind the vanity of the glutes. We're going to talk about the hip alignment and the anterior pelvic tilt. And then we're going to talk about some muscles that Sandra can help release and get to that we can't really get to on our own. So Sandra, I'll let you introduce yourself a little bit here and we'll kind of go on with the talk from there.
Thank you, Aaron, for having me. My name is Sandra Burton, and I have been a massage therapist for 26 years. I am available at Renew Mondays through Saturday, and I do have openings in the evenings. And so if you need something out of the 8 to 5 realm, I'm there for you. And I'm looking very much forward to talking about our subject today.
Yes, so there's some trends going on right now, and I want to kind of kick this off with the vanity part of it first, okay? So, Sandra, do you remember a long time ago, maybe you don't, about like the social media posts, and it was kind of like the duck lips, you know, and they'd have the big glasses and the trend that was going around. Well, now the new trend, it's all about the butts. If you see a female in the social media world now, their selfies are more about the backside. They're popping that hip up, you know, arching that back out and taking the picture from the backside. Well, there's some problems that could be associated with holding your posture like that.
Yes.
And you work on people a lot. Can you tell me a little bit about what you see when you are working on somebody with the anterior pelvic tilt?
It's very easy to see because I start people face down and I'm essentially at their head. And as I move my hands down on either side of the spine, what should happen is a nice slope when I get to the hips, and then I can come around this way. Oftentimes what happens is I come and I get this wall just stuck right here. And what happens after that is I have to spend a fair amount of time on their glutes to get them pliable enough to where I can come down and make a smooth transition. So what they're doing is showing up on my massage table.
Yeah. So with that, I kind of noticed this more excessively arched and anterior pelvic tilt in women. And some of that could be coming from that, you know, booty pop and kind of arching their back. So if a female doesn't have as well developed glutes per se, and they're trying to, you know, flaunt their butt out there a little bit more, they could kind of anteriorly roll their pelvis forward and arch that back.
Yes.
And they're holding that position, you know, even in public, not just for the selfies. Sometimes they're holding that for too long. And if you remember anything, do you remember like your mom ever telling you don't hold your face like that because it'll get stuck that way? So your body is like that. And men do struggle with anterior pelvic tilt as well, but I have noticed it more in women, and I'm trying to put the connection together here and see what may be kind of causing that even more so. So when you're doing that, we have found out that the glutes are more inactive, okay? When you have an anterior pelvic tilt, they're inactive. Have you ever heard of anything with like glute amnesia?
No, what I heard was dead butt syndrome.
Dead butt syndrome, glute amnesia, or even lazy glutes, sleepy glutes. So when you have that anterior pelvic tilt, your glutes aren't actually firing correctly, and they're lazy. So your glute muscles are really strong, right?
They're supposed to be.
One of the strongest muscles in your body. They help you burn the most calories, and they're the most dense muscle. And they're really lazy. So if you don't wake these glutes up and activate them and get them working correctly, you're going to struggle with a lot of hip instability. And there's some tight muscles that Sandra works on with this to help so your glutes can even function more properly. Sandra, do you have anything there on some of the muscles that you may?
Well, all three of the glute muscles, the maximus, the medius, and the minimus, are all part of the core, which that place pulls the bottom part of your body and connects it to the top. And you've probably heard it before if you've ever had massage, everything is connected. And so what I see is pain in the low back around L4, L5, S1, for those of you who know what that is. It's right at the very end of your lumbar spine and starting with the sacral. And many times what happens is a torque, a twist, which would make it appear that one leg was longer than the other. And it's not that they were born that way, some were, but it's because the hips are tilted in a particular direction. In other words, one is anteriorly turned and the other is back. And when you've got that kind of a twist, you're going to have pain, and you're eventually going to have pain. And what I've always said, at least for me, is pain is the most effective motivator. And so by the time people have that level of pain, that's when they come to get a massage.
Yeah. Yeah, so that's why massage is important also, because when you go to think about it, we do a lot of foam rolling and stretching here, and we help a lot. We can loosen up a lot of muscles, but there's just some muscles that I can't get to.
Well, and it's that, but it's also the fact that almost all muscles, if they are overcontracted or if they are stuck in a lengthened position, they're going to pull on their attachment sites. And so that's where, I can take an elbow, and don't freak out if you're thinking about, that's not what you want. There's different levels of pressure. The point is, the point of the elbow or my thumb or whatever can get to those little bitty areas that a foam roller can't. And so when I'm working on a glute maximus, I will do an elbow to the extent of their desire in terms of pressure. And I make little spaces, essentially the entire circumference of that. And all I can say is the people who have commented on how much they like my massage, there's a great deal of them who say, I had no idea I had any tension in my glutes. Had a girl leave yesterday, and she said, I can feel life in my legs again. And she happens to sit for a living, which, so many of us do. But the difference was, because of the massage, there was blood flow. There literally was life coming into her legs. And so with those, the bigger glute muscles, of course, the piriformis, some of the lateral rotator muscles are in there, and those are really easy to get to with an elbow. Again, the depth of the pressure is up to you. And it's remarkable for people to have that much of a perceived result in that area. And so many of them say, I come to see you for the butt work.
Yeah, that's good. And we've found out, and we know that when the glutes are inactive, the piriformis is going to be overworked. The hamstrings are going to be in the stretch position if you have an anterior pelvic tilt. And when you think about it, when your pelvis is anteriorly rotated forward and you have the low back arch, that then lengthens them hamstrings, and they're constantly in the stretched position. And most of the time when people think of this, they're like, hey, my hamstring's tight, I need to stretch my hamstring. Well, it's actually, if you got an anterior pelvic tilt, it's actually already in the stretch position.
Right.
And that's because of the inactivity of the glutes. So your hamstrings are going to be actually overworking,
Right.
doing their job too much, which can cause a lot of problems like knee dominance and this talk could go on real deep if we wanted to get into it, but it causes a lot more problems. So with the three main glute muscles you were talking about, we have the glute minimus, which helps with hip internal rotation, and it helps with hip stability of the lumbopelvic hip complex. And then we have your glute medius, which is more for hip abduction and bringing the leg out to the side. And it also helps with external rotation. And then we have the glute maximus, which is more predominant for like hip extension. And you can kind of think of anything bringing the leg back behind you.
Yes.
The hip extension, okay? So when you have weak glutes or your glutes aren't firing, glute amnesia, you are going to have tight hip flexors, you're going to have overworked hamstrings, you're going to have a really tight piriformis, and we have started to find out that that's one of the main causes for the SI joint to be out of alignment, which causes problems with sciatic nerve pain.
Exactly.
And it can go all the way down to your foot and ankle complex. So the glutes play a predominant role in your everyday life. So your glute max, think of getting up in and out of a chair. That is a predominant muscle for that movement. That's how important it is to have your glutes firing and functioning properly to make sure that you're able to get up and do the things that you want to do later in life. So Sandra, there's some other things that with the sciatic nerve and back pain, I'm sure you kind of get into a little bit over there. What are some things that you do for that in the hip alignment?
Well, the first thing I do is observe, and it's very easy for me, after having done this for as long as I have, is to just see. I can see all the way down on either side of the spine, and I can see whether the hips are one way or the other, and they can be like this way or back this way. When you think about how many different directions you can bend, tilt, torque all at the same time, there's muscles for every part of that. And so I start essentially with the muscles that are just above that, the QLs, and they fan out from your back, your bottom rib, and they fan out this way to the top of your pelvic bone. They are responsible for leaning and turning, and they're the ones that really grab the pelvic, the entire lower body, and hold it to the upper. And so those I work out, and I have found a technique that works for me. Of course, everybody's different as a massage therapist. But what I like to do is to start very slowly and without any kind of lotion or cream, and just warm up the area with my hand, and then just start pushing and pushing and pushing very slowly. I do that because it allows me to get a grab on the connective tissue, fascia, you may have heard it called, and fascia's everywhere. There's some just underneath the skin, there's some that's deep, but if I can push the whole tissue, that whole area, and open it outward, then I can come in and open it from the top to the bottom. And then my favorite thing to do really is to hook up underneath some of these harder to get to muscles and just work with my thumb. Working underneath the bone, there's muscles on top of a bone, there's muscles on the bottom. And some of the most effective ways to release them is to get up underneath. And so that's where I spend my time.
Yeah, that sounds like a lot of areas that you can get to, pretty deep in there. And believe it or not, it's going to be really hard to get to some areas like that with just a foam roll or trying to just get a stretch in there. It's almost like you need that assistance and someone who knows what muscles to even loosen up and work on.
Well, and you have to be careful because you were talking about an overstretched hamstring muscle because of the anterior pelvic tilt. And I'm not going to come in with I'm going to just really pound this area of the hamstring. I'm going to start with it as soft as possible, if for no other reason than to give the muscle the impression that I'm going to be safe, because there are a lot of people that have been hurt by deep tissue massage because there's too much pressure put on an overstretched muscle. And so I'm going to come in soft and work that area and then come in a little deeper and deeper until we can get that a little bit more pliable. And what happens, the important thing to think about, and I try just like Aaron does, to educate my people, my clients, an overcontracted muscle is short. As you continue to work it, if you're not stretching appropriately, it will continue to get shorter and shorter, and it will pull on its attachment sites. And so your hands, perfect example. Years ago, I had a friend who was on her way to get surgery for plantar fasciitis. And if any of you have had that, you know that it's a very exquisite pain. It will bring you to your knees first thing in the morning. I asked her if she would give me 30 minutes for 4 sessions, completely free. And she said, okay. And so the first couple times, she said, why are you not working on my feet? And I explained to her, I said, because the calf muscles, where they cross the joint. Muscles have to cross joints, otherwise they can't do their job. And they attach right where that pain is. And she had to kind of think that through, and I showed her exactly where her calf muscles were from the top all the way down. And then we went on up to the hamstring, and honestly, I'm not sure I've ever felt a more solid leg, let's just say, than I did with her. And so I really did have to do some hard work on those hamstrings. And by the 3rd session, she said, I understand what you're doing now. And what that meant was she was with me. And so as I was doing what I was doing, she had the vision and she could feel it let go. And by 4 sessions, she was completely fine. She did not need surgery. Now, please don't hear what I'm not saying. I'm not a podiatrist. There are plenty of reasons that your foot can be in trouble. But from a perspective of the lower body, even the glutes, there's a huge percentage that can be done and where somebody could get relief without having to do something more invasive.
Yeah, and with like the vanity of the glutes, we have more trouble that we've seen with women working on just their glute muscles and the vanity behind it. So with the vanity behind that, they're actually achieving like the hypertrophy of the glutes, and they're growing the glutes. They're making their glutes look nice cosmetically. But when you go to put them into like a movement assessment or an actual assessment to see how their body's moving and functioning, we're finding out that they're having a lot of hip instability still. So they're doing exercises like the glute bridge, the glute hip extension machine back here, the glute drive, to build them glutes up and strengthen them. Now, when they're not focused on the stability of the hips, they're pushing all this weight, they're getting the cosmetic effect, but they're running into more trouble like labrum tears.
Yes.
And knee trouble and foot and ankle complex, because the glutes are strong and they cosmetically built them up, but there's no stability in the hips and the lumbopelvic hip complex, which is causing these problems that we're seeing people run into. So sure, yeah, you can work out your glutes and achieve a nice looking glute. But you always have to remember, it goes all the way back to the beginning of this talk with the booty pop and the Instagram booty. What looks good may not feel so good later on. So the goal that we want to achieve here is where you can get a little bit of the vanity and the hypertrophy of the glutes, but also have the glute stability and the hip stability that you need for your lumbopelvic hip going forward. So that's what we do here with corrective exercise. And with corrective exercise, we inhibit the muscle first. So we'll soften and release the muscle. Then we'll lengthen that muscle that's tight. After that, we'll activate the muscle. So we'll get the muscle that we're working on activated, like your glutes that are really lazy, you got to wake them up. Then we'll integrate. We'll put them into an exercise that will be beneficial for that muscle group at that time. So that is the 4 steps for corrective exercise that we work on, and you just have to know which muscles are tight to release and which ones are weak that need strengthened, and which ones you need to really activate before doing certain movements.
Yeah, and one of the other things that I like to do is after working on someone when they're face down and after they're turned over is I reach for and get a hold of their hip bones here and gently rock them until they move a little bit more. I mean, we're talking about taking maybe 60 seconds to do something like this. And they are surprised when I try to explain to them, your front is connected to your back. You know, we think about, oh, the front of my body, I've got to work out, or in this case, the back of, but we're 3D, it all carries around. And so being able to rock those hips with those hip bones lets them understand that the front and the back are really just one piece. So that's...
Yeah, the core together, core together. So when you do have an anterior pelvic tilt, there's a lot involved. A lot of the muscles that we know that are tight on our side of things with the anterior pelvic tilt is going to be your erector spinae, is going to be really tight. We know your lats are going to be tight. We know the hamstrings are going to be stretched in the lengthened position. We know the piriformis is going to be overworked. And we also know that your psoas is going to be tight. These are muscles that are going
very
to
deep.
Cause trouble. Now, when you go into like hip extension, you're doing hip extension like some barbell hip thrust or glute drive, you have antagonist muscles that are going to stop you from being able to do the hip extension. So if you have tight hip flexors, tight rectus femoris, tight psoas, and you go to do hip extension, that's going to limit the ability for you to do hip extension. So what we would want to do, like I said, it goes back to the corrective exercise. We need to foam roll and release the muscles that we can get to and stretch them and probably do a psoas stretch, because we're not able to get down to the psoas with the tools here that we use, but we are able to get a little bit of a psoas stretch in, and then we can do the hip extension and get more effective workouts with the glutes actually activating and working. Now, when I talk about the lazy glutes, you have to wake them up before you actually use them, because they're lazy. They don't want to fire and work properly. You got to activate them. So if you can get an activation exercise, warm them glutes up, then go into a squat movement or a deadlift or hip extension with a barbell hip thrust, then them glutes are going to be firing and engaging properly. So Sandra, did you have anything else there that you could think of on the massage side that you'd like to touch base on?
Honestly, probably the greatest thing that I can do for my clients is, as I said before, is to educate them as to the anatomy and how it works, and then give them a concept that they can take with them. So where you were talking about the anterior pelvic tilt connected to your quads, often when I have people come in with low back pain, which is, where we're talking about here, and after I've worked the glutes, all the way around and underneath and every place I can get to, I always have them turned face up so that I can lengthen the quads. And they're always surprised that even their quads are tight. And I mean, we're talking they cross the hip, they cross the knee, and once they understand how that works, then when they start walking at home and they start sitting and pay attention to the fact that the quads are like an anti-gravity muscle because they're the ones that push you up. And so when they are more aware of how this works, their next massages go much better.
Yeah, I would agree. And I love massage too. Massage it's not only, there's a lot of things that go into the massage too, like that I've noticed from my side. It's not always just about releasing the muscles too. There's a lot of like relaxation
Absolutely
in there, and calming, and like the stress relief and calming of the body just being in there. And once you can achieve actually calming that down, like that's when we find that your muscles will actually release more.
Absolutely. And if there's anything that I can say to that, we have a relaxation response in our own bodies. The problem is we override it all the time because of our lifestyle. And if there's one thing that I try to do with anybody who comes in, there is a phrase that starts like, I carry my stress in my neck and shoulders. And I encourage people to drop that first part of that and just simply say, I have stress in my neck and shoulders, because your brain is listening. And when you say that you're carrying it, it's like either you picked it up or somebody gave it to you. It's volitional. And if you can drop that, then we can go right to the problem. So I know that's a little bit subtle, but it's a very powerful thing.
Yeah, thanks for sharing that. That is true too. It all goes down to how you're thinking and feeling, and there's a thing called postural stress.
There you go.
And when you can relax, you can let go of some of those stresses, and your muscles can actually start to release and help with like back pain and knee trouble and foot and ankle complex. But it all lies down to, getting those glutes stronger, getting your core stronger as well. It's not just the massage and releasing. Now, we all work together here. It's really important to make sure you're getting massages as well. And even when you're actively working out, because the blood flow and the muscles that we can't get to without a massage therapist. So that's why it's so important, because if we can't get the blood flow in the muscle, or the muscle to start working more properly, then you can become found in more imbalances and more trouble later on down the road. So that's about all we got today, Sandra, on the talk. Today we talked about the vanity of the glutes and the trouble behind the vanity of the glutes. We talked about anterior pelvic tilt and hip alignment, and we also talked about some muscles that are tight and things that a massage therapist can help out with releasing some muscles that we're unable to get to. And Sandra, where are you located again?
I'm at Renew Salon and Spa. It's at 1419 Main, so we're right across the street from the courthouse. Very easy to find, and it's a very lovely place to come and relax, and I'm there for you.
It's a very nice place. I've been inside Renew. It's very nice. So if you guys have time.
Go ahead. I was just going to say, whoever's watching, just know that you have a $10 off discount when you come in and say that you got it from Iron Therapy. So we're going to call it an Iron Therapy $10 discount. And so let me know.
All right. And that is a nice place that she's talking about. And if you guys ever need anything, don't hesitate to reach out to Sandra. And I'm here as well if you guys need anything with your exercise, fitness, doing a full, complete body transformation, and getting your life and health back. Reach out. Let's start that conversation, and see, if there's anything we can do here to even help you out. This is Aaron here with Iron Therapy Training, and we'll see you guys soon.